Hi, I'm Gary White for Central Kentucky Television. I'm here with Dr. Johnny Isaacs with Isaacs & Isaacs General Dentistry right on Bobolink Drive in Springfield for our dental care health tips for the month. And it's August now. And we mentioned in August, we celebrate National Fresh Breath Day.
Wow.
On August 6th, actually.
Who knew?
Who knew? Exactly, exactly. So we're going to talk a little bit about fresh breath and halitosis and all that good stuff. So what causes people not to have the freshest breath?
Well, it's usually a combination of factors. About 80% of it is from the oral cavity, and that would be cracked fillings, could be gum disease, it could be decaying teeth, could be bacteria on the tongue, and that attributes for about 80% of it. And a lot of times, because of something called olfactory fatigue, which means if you get used to your own scents, you don't even know it. Somebody might tell you about it. You might run the kids away, or the dog away, or something like that. So what drives people to treat it, you never really know. But it's estimated that about a third of all dental care is driven by somebody thinking they might have halitosis or fetor oris. It's a term that I prefer to use. Halitosis is a general term. It just means that there is an odor emitting from your mouth, which could be it's usually sulfur compounds, but it could be from your body too. So that could be a systemic disease. It could be cancer. It could be a lung disease. Could be an infection. Could be something as simple as a sinus infection doing it. Chronic sinus infections do it too. So you don't know exactly what it's doing until you eliminate possible contributing factors, and that would be a trip to the dentist and just to get a good checkup to make sure that you don't have anything offensive emitting from there. And that's what we do. Whenever we do an exam, we certainly look at the gums and the teeth and also the tongue. But that attributes for about 80%. So it'll be 20% that are systemic diseases. And another possibility would be diabetes. A lot of people that have diabetes, they have like a fruity smell to them if it's untreated. The diabetics produce a lot of ketone, and that will give it like a fruity sensation, or a fruity smell to it. That can be offensive too. So get it checked out, whether you see your dentist or MD, and they can probably direct you. Yeah.
So some people though feel like even if they keep brushing or if they use mouthwash, that won't necessarily eradicate the problem.
Well,
then.
sometimes some mouthwashes will make it worse, and there's something called xylitol that is very good now. You can go to the drugstore, ask the pharmacist for xylitol, and that's a good, fairly new drug that's come out, and it treats it too. Some of them will just mask it for an hour or two. Some of them I've seen it says 3 hours. Some of them say 12 hours. That's a xylitol. So I would try that. And there's something called Halitov Phobia, where people think they have it and they don't, and that's a lot of things, because it can, socially it can wreak havoc on your mind if you think there's something offensive about you, and it may keep you from being outgoing and keep you from going out and seeing people. So get it checked out. There's something called a halitometer also. I don't particularly have one in my office. I've never seen one, but I've read about them, and that is a device that you can actually put in your mouth and you blow into it, and it gives you a reading out that you can utilize to some extent. But I've never even seen one of those things. But it's a halitometer.
So when people, if they continue to maintain their mouth and they brush and floss and stuff, they shouldn't have the issue of halitosis or bad breath?
Right. If it's persistent, if you've ruled out the gums and the teeth and the tongue, whenever you brush your teeth, you're only getting about 20% of the surfaces. So make sure you brush your gums too and your tongue. Give it a couple of good licks. Even if it chokes, you go ahead and push it back in there and do it. A lot of people, it gags them, so they're reluctant to really get after it with a toothbrush. But go ahead and be aggressive, and don't be afraid to do it. That's what I'd recommend. And that would as soon as you eliminate that, then you can look at some possible diseases that are causing it. It could be gastric problems with your stomach. A lot of people, if you smoke a lot, that can do it, and also drink alcohol. If you drink alcohol, it will deplete the salivary glands, and they don't secrete as much saliva. So your mouth is dry all the time, which is xerostomia. If you have a dry mouth, that allows the bacteria to grow at a faster rate, and that will take over too. So if everything's healthy, you shouldn't do it, but there's usually an underlying problem, a reason for it, and just finding out what it is. Of course, a lot of people, it's hard to get people to quit smoking. A lot of people, they're not going to curtail their drinking if that's a social factor too. So there's then the obvious things are onions and garlic. That will do it too. The onions and the garlic will get into your stomach, and not only do you have the immediate effect of it, but it can last for hours until that is washed out of your stomach and neutralized with the hydrofluoric acid.
So it can depend on what you eat as well.
Exactly. Yeah. So you got diet, you've got possible disease, and you've got oral factors too. So 80%. Keep in mind, 80% of it is oral factors.
Now, some people also have these little mouthwash things in their pocket.
Yeah, it's trouble.
That's good stuff. Is it good or bad to utilize them
this
or
is good.
mouthwash?
This is good. This is a Listerine. Of course, it's medicated also. So these things are effective. They don't. I've used these before. They don't have as much sugar as some of them. I would try to stay away. You don't have it open yet, Gary. So
when I need it.
You're doing fine. Stay away from the sugars. A lot of people will put candy in there. Of course, sugar will grow bacteria. There are certain bacteria like the mints, and it works for a while, but it won't. Eventually, it will. The bacteria will culture, and you'll have a bacteria overload.
So you're kind of compounding the problem with it.
Right. So it's just there's a balance. Like everything in your body, is just a balance. If everything's healthy, then you don't. But and the way we put our bodies through things and mouths, and we're constantly eating and feeding bacteria, so it could be a problem.
So you just maintain the proper dental hygiene.
Brush and floss daily. We recommend at least twice a day. I think we touched on this on one of the early segments. When I was a kid growing up, it was always 4 times a day. But the way we kind of live and we're on the run all the time, if you can get it twice a day, you're doing pretty good. So we want you to brush, and we want you to floss. You can use an adjunct. You can use a mouth rinse too. There are certain prescription mouth rinses. Chlorhexidine. We use quite a bit of chlorhexidine, which is Paradex is the brand name. We use that. That is prescription. But if you have that, if you have access to that, make sure you brush and floss before you use it, because it will stain teeth, and I've seen that happen too. A lot of people, you can't just use it as a mouthwash solely. You have to use it in combination of brushing and flossing.
And using mouthwash every day when you brush and floss is okay?
Some of it has alcohol in it. A lot of them now, there's something I use called Zero. It doesn't have no alcohol in it. So
that's better for you.
And some of the older ones, they've up to, I think, 70-80% alcohol. I mean, it's got a lot of alcohol in it. So you want to try to avoid that.
Okay.
It won't hurt you. If you do it once or twice a day, but if you keep putting that alcohol in you and you smoke, you're setting yourself up for oral carcinoma, squamous cell, which is a very difficult cancer. You don't want to get that.
Okay. Well, again, I've been talking with Dr. Johnny Isaacs with Isaacs and Isaacs General Dentistry, right on Bobolink Drive in Springfield. What's the phone number out here if they want to give you a call?
Phone number is 859-336-7680. 336-7680.
Thank you very much. This has been Gary White for Central Kentucky Television.